Good day, I'm Hyacinth Erica Francine Olivo Liwanag, and for this video, I'm going to perform the proper hand washing techniques. So, a hand hygiene is considered as a primary measure to prevent infections, and also it is the single most important procedure to deter the spread of microorganisms, and therefore to prevent healthcare associated infections.
Prior to conduct of the procedure, first ensure that the equipment to be used are complete, and this includes an easy-to-reach sink with warm water, an antimicrobial soap, and a paper towel. Next, we need to stand in front of the sink. And remember that the sink is a contaminated area, and so we must avoid touching it. And also, our uniform should never come into contact with the sink, so as to prevent the transfer of microorganisms into our uniform. Next, we have to remove all of our jewelry such as our wristwatches and rings because microorganisms can lodge into the settings of our jewelries. Next thing that we need to do is to turn on the water. And of course, adjust the pressure. And next, thoroughly wet the hands and the wrist areas. And the hand and also the forearm should always below the elbow so that the water flows from the least to the most contaminated area of our hands. Assess your hands. And of course, make sure that our nails are short. Check the hands for the break in the skin such as the hangnails or cuts because open cuts of the wounds can harbor high concentrations of microorganisms. Next is choose about 1 to 2 teaspoons or a pump of a liquid soap from the dispenser or lather thoroughly the bar soap if you're using one. With the firm rubbing and circular motions, wash palms and the back of the hands. And of course, each fingers and also the areas between the fingers, the knuckles, the wrist, and also the forearms. Wash up the forearms at least as high as contamination is likely to be present. Wash at least 1 inch above area of contamination. And if our hands are not visibly soiled, wash the 1 inch above the wrist. Next is to rub your right palm over the dorsum of your left hand with the fingers interlaced, then vice versa. Next is to rub your hands together, palm to palm, with the fingers interlaced. Rub the back fingers to the opposite palms with your fingers interlocked. Perform rotational rubbing of each thumb palms while clasped in the opposite palm. Next is to rotationally rub the clasped fingers of your right hand into the left palm and vice versa. Interlace the fingers and thumbs. Continue the friction motion for 10 to 30 seconds. With a firm rubbing and a circular motion against the palm of the other hands, then do the same to the other hand. Then rinse thoroughly using an upward motion from the fingertips down to the wrist. Then wash hands for a minimum of 15 seconds. Then pat dry the hands and the wrists thoroughly with a hand towel or a paper towel. And lastly, turn off the water and use the paper towel to off the faucet.